start MCQ part. just just like narrowest 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 part of the airway in infant is the subepiglottic subepiglottic. A 15 years boy present in the recurrent episode of epistaxis, unilateral obstruction, and what is the most likely causes? Most not, likely causes is the nasal angiofibroma. Abductor of vocal cord muscles is the only one abductor vocal cord muscle is the posterior cricoarytenoid muscles. Remaining muscles are the adductor muscles. Remaining muscles are the adductor muscles. Ranula management, which of the following step is the correct? Excision ranula and sublingual gland duct. Excision of only the cystic swelling. In large ranula, marsupialization of not preferred. In a small ranula, marsupialization is preferred. Which one is the correct? Excision of ranula and sublingual gland duct is the correct answer. High tracheostomy done in which condition? High tracheostomy done in which condition is the laryngeal carcinoma condition. And a patient present with the profound a patient present with the profound sensorineural deafness and not responding to hear aids not responding, with intact auditory nerve function. 8 cranial nerve is the functioning. Which of the following procedure is the preferred in this case? In this case, cochlear implant. A patient present with the nasopharyngeal carcinoma with a bilateral lymph node, epistaxis, and hearing loss. Which is the most common cause of the deafness in the patient? Present in nasopharyngeal carcinoma, in bilateral epistaxis and hearing loss. Which is the most common cause of the deafness in the patient? Serous otitis media. Then nasal mass with extension from the maxillary sinus. Which likely case of nasal mass with extension from the maxillary sinus is most likely case of the aticochondral polyp. Then which of the following is the derivative of the first pharyngeal arch? First pharyngeal arch is the interior belly of digastric muscles. Which is the ossicle lever ratio? Which one is the ossicle lever ratio? 1:3:1 is the ossicle lever ratio. Endolymph is secreted by Asteria vascularis. Surgical landmark of mastoid antrum. Surgical landmark of mastoid antrum is McQueen angle. Which muscle arises from the fourth pharyngeal? Fourth pharyngeal muscles arise from the fourth cricothyroid muscles. Ear lobule is made of the skin and fat. All of the following nerves supply of the auricle ear except greater auricular nerve supply and lesser petrosal nerve not supply, auriculotemporal nerve supply, lesser occipital nerve supply. Which one is the correct answer? Lesser petrosal nerve. All of the following nerve supply the medial aspect of the auricle. All of the following nerve supply the medial aspect of the auricle except is the temporal auricular temporal nerve. Major portion of auricle is supplied by great auricular nerve. Which nerve is supply in the major portion of auricle? Greater auricular nerve. Arnold nerve is the branch of the vagus nerve. Jacobson nerve is the branch of the which nerve? Glossopharyngeal nerve. Which of these is not a derivative of third pharyngeal branch arch? Which? Lesser cornu. Greater cornu of hyoid. Greater cornu of hyoid is derived from the which brachial arch? Third brachial arch. Which of the following intrinsic laryngeal muscle is not derived from the brachial arch? 6. Cricothyroid muscles. Thyroid cartilage derived from the which brachial arch? 4 and 6. Steps derived from the which brachial arch? 2. All are derived from the brachial arch. All are derived from the brachial arch except mandible is the derived from the brachial arch. Laryngeal cartilage is the derived from the brachial arch. Steps is the derived from the brachial arch. Which one is the not derived from the brachial arch? Ultimo brachial body. Ultimo brachial is the not derived from the brachial arch. So answer is the ultimo brachial body. All are true about external auditory meters except it extends from the bottom of concha to tympanic membrane and measure 24 cm in length. Fissure of the centronian cartilage part can transmit infection to the parotid or superficial mastoid infection. Foramen Fmge present from anterior inferior part of the bony canal. Outer 1/3 bony and inner 2/3 cartilaginous. Outer 1/3 is the cartilaginous and inner 2/3 is the bony part. So which one is the not true? D. Length of the cartilaginous part of external auditory canal is less than 1 cm. Foramen Fmge and congenital pathology located between bony part of EAC external auditory canal and submandibular gland. Cartilaginous part of external auditory canal and submandibular gland. Bony part of external auditory canal and parotid gland. Cartilaginous part of external auditory canal and parotid gland. Which one is the location of foramen Fmge and congenital pathology? The bony part of external auditory canal and parotid gland. In between located foramen Fmge. All are true about the external ear except auricle is made of the framework single yellow elastic cartilage covered with skin. All area between tragus and crest of helix without cartilage in sura terminalis. Cartilaginous from the tragus can be used in the reconstruction surgery of nose. Composite grafting of the cartilaginous and skin from the pinna cannot be used in the correction of defect of nasal ala. All are true about external ear except the composite graft. Cartilaginous skin from the pinna cannot be used in the correction of defect in nasal ala. What is the length of the external auditory canal? Is 2.5 cm. Criminous gland are seen in which of the external auditory canal? 1/3 outer. Retromolar trigon is located at posterior part of the mandible. Sorry, it's not a correct answer. Retromolar trigon is located at ascending ramus of mandible. Retromolar trigon is located at the ascending ramus of mandible. Then we start anatomy of middle ear and inner ear. Which is the peripheral receptor of hearing? Organ of corti is the peripheral receptor of the hearing. The semicircular canal is responsible for what? Balance. Promontory is seen in which of the wall of middle ear? Middle. Promontory is seen in which wall of middle ear, middle. Eustachian tube open in nasopharynx. Which part? Nasopharynx. Stria vascularis present in which part? Cochlea. Cochlea. Otoconia is seen in utricle, superior semicircular canal, lateral semicircular canal, and cochlea. Otoconia is seen in utricle. Least blood supply goes to the handle of malleus, body, incus, long process of incus and steps. So least blood supply goes to which one is the correct? Long process of incus. Least blood supply goes to the long process of incus. Chorda tympani is seen which of the middle ear? Posterior wall. Anterior wall of middle ear is also known as outer wall, mastoid wall, carotid wall, jugular wall. Which one is the also known as the anterior wall of middle ear? Carotid wall. Carotid wall is the also known as anterior wall of middle ear. Which one of the following is the not content of the middle wall of the middle ear? Which of the following is not a content of middle wall of the middle ear? Oval window, round window, process, cochlea, formalis, auditus, and antrum. Which of the following not content middle wall of the middle ear? Auditus and antrum. Tegmen tympani separate middle ear from middle cranial fossa. Otosclerosis is in which wall of middle ear? Middle ear. Tensor tympani inserted in tympani when malleus incus steps. Which part? Tensor tympani inserted in the malleus. Fallopian canal contain which nerve? 7th cranial nerve. Length of internal acoustic metres is 1 centimeter. Shortest length of middle ear is the 2 mm. Bayer's bar divided is the facial nerve and superior vestibular cochlear nerve. Divided the facial nerve and superior vestibular cochlear nerve. Cochlea main function is the hearing. Cochlea main function is the hearing. All are required after balancing except visual system balancing perception, vestibular and cochlea. Both are the required of balancing. Only olfactory system. Cupula is seen in which part? Sacula, utricle, semicircular canal, cochlea. Which part? Semicircular canal. Stria vascularis is seen in the which part? Vestibule, utricle, cochlea, middle ear, cochlea.